So inflammation. Uh, Inflammation happens because, well, there's a lot of different reasons. So if you look at what inflammation is, it is a reaction that the body has to some kind of damage or some kind of problem, but there's usually some kind of damage going on. It could be from chemical problems. So for example, if you have toxicity of some kind, you can get inflammation. If you have infections of some kind, any kind of infection can cause it, a virus, a bacteria, a fungus. And that's often chemical as well, because a lot of these, for example, fungus or bacteria or parasites produce toxins, and the toxins damage some of your own cells. And when your cells are damaged, they send out distress signals going, there's something wrong here. This is not supposed to happen. So this is really interesting, because when there's like an infection that's damaging cells, it's a completely different issue than when it's your own immune system taking out damaged or injured or dead cells. When your immune system goes there, there's like a whole bunch of cells. This is really weird the way this happens. So you see all these cells lined up, and they're like a row of houses, right? And the cell's going along, and it's kind of sniffing out the cells, and there's stuff on the outside of the cells, and it's kind of like the row of houses that are all the same color, and they're all, oh, this one's pink, okay, 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 this one's blue. Blue, it's not supposed to be blue, it's supposed to be pink. And then what it does is it eats up that cell. It just completely eats it up, digests it, and spits out the amino acids. So it digests the protein completely, and that is does not cause inflammation. But when you have an infection like a virus, the virus gets into the cell, makes a whole bunch of other viruses, and then explodes out of the cell, so that the viruses spew out all over throughout your body. And when we're talking about a viral infection, we're talking about, when you measure in the blood, you're talking about millions of copies per cubic centimeter of blood. Millions, that's how many are in there. This is a lot of viruses. And then those cells that are broken open, they're leaking out all this stuff that's not normally in the blood. Enzymes and proteins and microtubules and all these things that are not normally in the blood. So the immune system goes, oh my gosh, there's something wrong here, and starts investigating and finds the virus, and then starts making antibodies to grab up all those viruses that are all over, all those millions and millions and billions of copies that are being made. That's inflammation. So you think, well, I don't have any infections. But you might. So for example, this came up, but Leslie was talking about gum disease. People have infections in their gums, and it's just swollen and red and kind of irritating that you got this redness in your gums, and you brush your teeth. And when you brush your teeth, the bacteria actually get into your blood, and they're swimming around in your blood. And that inflammation is releasing these inflammatory mediators, they're called, into your blood. And that makes your immune system a little heightened, but it also does something else regarding heart disease, and that is inflammation causes you to make something of what's called fibrinogen. Fibrinogen is a protein that clots are made out of. And so, because if there's some damage or injury, you want to be able to clot it off really quickly. So you make a little extra of this fibrinogen, and then you make clots more easily. If there's any damage done to your blood vessels or anything, then it clots up a lot. And also the other thing is that when you're in this inflammatory mode, you don't dissolve clots very easily. You don't take them up. So you have this blood vessel with, remember, it has that lining in it called the glycocalyx. And that's injured and damaged, and then it makes a clot there. It forms a clot because of the damage to that lining. And then the APCs come and pave over that to make a new vessel, and it's got the clot that's still on the inside of there, but it's paved over so that the blood vessel is still, you can still put blood through there. But that clot has to be dissolved. What if you can't dissolve it? Then it just stays there and it organizes, and that's what it's called, organizing. And that's made into a fibrin, and this fibrous clot forms, and there's a lot of blood cells in there. Because there's blood cells, there's cholesterol in there, and all of that stuff it just sits there. And then if there's any other damage, because now there's a bump there, it's more likely to get damaged. And then so you wear away the glycocalyx, and you make more clot, and then you make more clot, and then you make more clot. But why isn't it dissolving? Well, because you're in inflammatory mode. You're doing inflammation, which causes you to clot and stops you from dissolving clots. And so this chronic inflammation is really bad for heart disease. Well, heart disease is really bad for your blood vessels generally, whether it's your carotid arteries or, strokes in your brain or in your legs or whatever. All of this chronic inflammation, it says to your body, oh yeah, be careful. There's something here that's wrong, and you're going to need to plug up holes and clot off the blood. And don't dissolve the clots, because then they'll start leaking. So now you're put in a really bad situation by having this chronic inflammation. Now, if you have it a little bit here and there, like let's say you get injured, actually, you fall down and you hurt yourself, and I don't know, even break a bone or whatever, then you need to clot all that off. So you got all this extra fibrin and you clot it all off. And then over a period of months, like 3 to 6 months, the inflammation goes away, it heals, your bones are healing, the inflammation's gone, you can start using your bones again, maybe 6 weeks later, and then the clot starts dissolving in there, and this is kind of a gradual process that happens. Well, what if in the meantime you get another injury? Then you're back to making more inflammation, and then you get every few weeks you're getting some kind of inflammation. Well, that's kind of like chronic inflammation. That's kind of like just having gum disease, or just having a chronic infection. People have Lyme disease. People who have toxins in their body. Some people take in toxins in their body. People with diabetes have excessive amounts of glucose, and they're not able to use fat for energy. So they have a lot of oxygen-free radicals creating inflammation. And that it's not that you have inflammation, it's that you never don't have inflammation where you can dissolve all the clots and clean everything up. Now, that's a really cool thing, because if you think about it, you go, well, what would I do? How do I get rid of all this chronic inflammation? I'm drowning in all this inflammation. There's a really simple, easy, cheap way to do it. So everybody thinks, they tell you have to start popping pills to get rid of inflammation. And there's actually some good research on that. Ibuprofen is actually a good anti-inflammatory, and it decreases inflammation, and it decreases your risk of heart disease, and it decreases your risk of cancer. But it's got some problems. It also prevents you from healing and causes stomach ulcers and bleeding stomach ulcers. You can't clot, so you bleed like crazy. And the aspirin does the same thing. So the anti-inflammatories, it turns out they're not the answer. Everybody thought, oh, I'll just take an aspirin. When I was in medical school, one of my professors got the Nobel Prize for figuring out how aspirin worked. And he told us in our pharmacology class that someday, he said, I remember him saying this, someday you're going to have an aspirin lick. And you're just going to, as you walk out the door, you're just going to lick the aspirin. And that's going to start your day so that you don't get any inflammation, and you don't get any heart disease, and you don't get any vascular disease. Well, it turns out that that's kind of been tried and tested. And yes, you do have decreased vascular disease, decreased heart disease, but the risk of getting bleeding problems is greater than the benefit you get from the aspirin. So it's not really a good idea. Okay, and then all these supplements, people are selling these supplements for like crazy prices. I had a woman, one of my patients, spent $9,000 to do incretin therapy. She was getting injections of peptide hormones, in order to decrease the vascular disease. And I'm like, you know what? You can get all those incretin hormones for free. And it's really, really simple. All you have to do is have an empty stomach. When you have an empty stomach, it suppresses inflammation. I'm not talking about you just don't make more inflammation. It actually gets completely rid of inflammation. You have zero inflammation when you're fasting. So your stomach being empty is the single best thing you can do for heart disease. I had a patient who was told he had to have I've told this story before. He had to have a cardiac bypass surgery or he wasn't going to live a month. And this is a guy who couldn't walk across the room without getting chest pain. He was really in a bad way. He had bad heart disease. And so I told him about, you can heal this with an empty stomach. So maybe intermittent fasting. He goes, no. And this was his idea. I am not going to eat anything for a month. So for 30 days, he fasted. And during those 30 days, he went from not being able to walk across the room to playing a full tennis match. He was a tennis coach. He was playing a full tennis match and then going to the gym to work out and never had any more chest pain. In fact, for the rest of his, until now, I don't know. It's been 5 years and I haven't seen him in a year or so. But up until then, no chest pain at all. And so he essentially cured it with 30 days of water fasting. That suppresses inflammation and all those inflammatory mediators that cause you to make more fibrinogen and to cause clotting to happen and prevent you from dissolving clots all goes away, and you dissolve everything out. You take everything out. You clean up. Everything cleans up when you're not eating. It's just amazing. The more research that's done, the more remarkable it seems, because it's like miraculous. Everybody's like thinking like they have to pop some pill or I don't know, run a marathon or do something amazing to clean up their body or do a cleanse and a detox. I have people spending $10,000 to go to a cleanse program in San Diego, and you know what? You can do it for free at home. It's really easy.